I think it's important now for patients to know what we are doing to keep you safe. So the community has done a good job in staying distance and controlling their own space and their own environment. We've done and made some significant changes here in our environment, and I think it's important that you understand that. For example, when you pull up to clinic, you'll find that there's a number on the door that you're supposed to call, and people are waiting in their cars now. We are not having people congregate in waiting rooms. That's not safe at this point in time. We're also not having people queue or line up at check-in and check-out. We're not doing that anymore. Again, it's probably too hard to keep effective social distancing in that setting, or there might be just some areas where there could be mistakes made. So people instead are waiting in their cars. When we're ready to see them, the nurse calls them and we'll meet them at the door. The nurse is masked. Everyone at Samaritan is masked at this point in time, and we will give the patient a mask as well. Once they're in, the nurse will take them in, get their vitals, and move them to an exam room. At that point, the nurse and physician will conduct the visit, and then the patient is discharged directly back outside, again, not stopping at the checkout counter. These are important things so that you understand the chain that happens is you go from your safe environment to your car, from your car directly to an exam room, from an exam room directly back out to your car, and then home. In doing so, I think we are really truly able to keep patients safe.
I had a scheduled appointment for today, and I was going to cancel it. And when I talked to my doctor, he wanted me to come in. He didn't want me to cancel, and he said that they do all safety precautions. And he started to tell me what they would do. They would come to the car, give me a mask, do some safety checks. Then I would come in and bypass the waiting room and go directly to his office. So I had no fear of coming. After he told me that, I was very happy, and I said, I will definitely, be there. I have a lot of health issues, so I was glad that I didn't have to cancel. And I would highly recommend this to anybody that I know that has an appointment and is in fear of coming, or afraid to come in.
We at Samaritan understand COVID. We understand how lethal it can be. We are up to date on the latest practices of prevention and treatment. Nevertheless, the leading killers of America are still heart disease, stroke, and we need to see our patients to reduce this risk, such that they're healthy now and such that they'll be healthy when this COVID pandemic abates. There are a subset of patients that no matter how good telemedicine is, we have to see in the office to give adequate care. There are some patients that telemedicine is excellent for, and we've become very adept at using it, almost perfecting it, I feel, and those patients will be all right to see by telemedicine.
I told my doctor that I was too scared to come to the office, and she said that it was low enough risk that I could do a virtual visit over FaceTime. I was happy that my doctor was ready and able to use FaceTime as a solution to coming into the office. At my age, my health is really important to me, and I'm glad that Samaritan had an option for telemedicine.
I do hope that, having explained some of the modifications that we've made, people will feel more comfortable in coming from their environment to a carefully controlled environment here at the clinic, and then back to their own environment and feel safe in doing so.